Hi, I'm Dr. Peter Leo, and I'm here to answer some questions today from the community. Today's question is, how best to prepare for a telemedicine or teledermatology visit? And the answer is that this has been pretty tricky for everybody. I think we have used telemedicine to some degree in the past, and with certain patients I've been able to look at photographs and even do some live video, but now we are almost exclusively using teledermatology. So it has been pretty interesting for everybody, both patients and providers alike. A couple of tips I think that are really helpful. Before the appointment, it would be really great to make sure that all the questions are sort of in line. We know exactly what we want to cover during that visit. And as a patient, I think knowing the questions you want to ask and knowing all the key points of the visit you want to hit in advance will help make that really efficient. I find that it's difficult to have a longer visit during video, especially with technical issues that seem to inevitably pop up. So a patient that has a list that is organized, that really helps me because I know we've gotten through everything that they wanted to talk about that day. The second is to make sure that the technology works before. Unfortunately, a lot of patients sort of wait until right at the time of the visit, and then we're trying to frantically figure out if it's their phone or their computer, if there's some issue going on. So if you can check it beforehand, that's fantastic. The next is we want to make sure that we're in a well-lighted environment and that the camera can really see everything we need. This is particularly tough with desktop computer systems. If the camera's way up on top and you have to show somebody your foot, then you have to be a little bit of an acrobat. And for some of my older patients, I actually had a patient just today who said, yeah, I can't do that. So I said, okay. So she's going to take some photographs and send them to me separately. That's another point that can be helpful, especially for smaller lesions or pigmented lesions. It is really nice to get a high quality, well-lit photograph and see if your provider can accept that either in advance or right after, or sometimes during. In fact, the system that we're using allows me to request an image. The patient can then send me that image and I can review it while we're talking video. So it's really nice because a lot of times the quality of the video is just not high enough to see something in great detail. Those are a few tips I think that are really helpful. And finalizing the visit is really important too. At the end, I say this is not the end of the connection. This is just the end of the video. Usually I'm trying to send sort of a follow-up email message through our patient portal to our patients. And I think that's a great thing to do is to say, look, can I reach out to you if I have questions or concerns? Do you have a patient portal or is there an email that I can use? Because that really helps round it out. I can send the list of recommendations that we made during the visit. For products, I can send patients a link so they know exactly which one to pick up, especially for the over-the-counters. And I also like to put in the pharmacy that I sent the prescriptions to, because sometimes there's confusion if people have multiple pharmacies on file. So all of those pieces I think can come together to make a video visit just about as good as a real visit in many ways. And I have to say, for most of my patients, I feel pretty satisfied at the end of a video visit. I hope these are helpful tips and I look forward to seeing you at the next one. Thank you.